A great day to all of you. Welcome to Dr.Girish Talks. The previous video was in Malayalam, so this time it is in English. There are a few reasons for that. The previous video was in Malayalam because it was a response to another Malayalam video by a so-called Yuktivadi as well as an allopathic doctor who said Panchakarma was a spurious practice. Ayurveda itself was a spurious practice according to his previous other talks. It was not meant to be a personal attack on anybody or an attack on any system, because I respect all systems. Give and take respect is my policy, so I would like to expect the same kind of respect from others. Now, in the previous video, I had mentioned about certain details about Panchakarma practices which he had mentioned as spurious. Now, what the doctor had mentioned in short is that Panchakarma, the listing of Panchakarma from his side itself was wrong. So I had corrected that, and among the Panchakarma procedures, I had corrected certain aspects of it. Now, for example, he said Shvedana or the sudation therapy is one of the main Panchakarmas, which is based on the thought process of Ayurvedic physicians that sweat is mala or a waste, and if it is cleared, all diseases are cleared. No, I disagree with that. Shvedana is part of the Panchakarma, but it is a preparatory phase procedure like the Purva Karma. There are certain diseases which can come down with Shvedana, because Shvedana works also as an anti-inflammatory activity. It's more of a symptomatic line of treatment, just like how you have some pain over your body and then you give heat therapy, warmth, and the pain subsides for some time. But then it's not the main therapy, it's part of the Panchakarma. He also mentioned some wrong things about Vamana, where Vamana is a procedure of detoxification through the upper orifice where vomiting is done. He says continuous intake of ghee in large quantities will make you vomit. No, that's not the way it is done. Snehapana, what he mentioned as the ghee intake, is actually made to bring out the toxins. So there are certain fixed procedures for that. Snehapana is part of the Snehana procedure in general. The Snehapana is the ghee intake. It is very particular that some medicated ghee is given to the patient over a period of time depending on the digestive number of hours they take to digest and all that. It's calculated like that, and the medicine is very specific to person depending on the prakriti of the patient and the vikriti or the dosha vitiation in the body in the particular disease which is mentioned. Now, after that, part of the Snehana is also Abhyanga. After Abhyanga is systematic oil massage, and then it is removed. The toxins are removed. There are quite a lot of patients who can vouch for the practice of Vamana, who have undergone the procedure of Vamana and have become better. Now, similarly, when he is talking about Vasti is the enema, medicines introduced through the anal route. He says the large intestine does not have the capacity to absorb. So what are you doing? That's what he had asked. Now that is a very childish statement, I would say, because in any paper you find, published papers, you will find that there are four activities of the large intestine: the absorption of water, absorption of minerals, the fermentation of the food by the bacteria present, as well as the formation of the feces. So these are the four activities. This is not what I say, this is actually published in NCBI papers. All materials I am going to talk about here is based on papers already published by reputed journals, peer-reviewed journals. Now, in the same procedure of Asti, he mentions that it is very barbaric the way he mentions that a bladder of an animal is taken, it is filled with medicine, and then it is pushed through the anus of a person. No, that's not the way it is done. Earlier days, yes, the bladder of an animal was used because those days there was no ambu bag. or any instrumentation which is similar to the amoeba bag, through which they can pump out the medicine. So the bladder was used. It's not like a bladder is just taken out and with the urine, along with the urine, the medicines are pushed inside and then used for the medication process. No. Cleanliness has always been key for all Ayurvedic procedures, and there are different methods of cleaning the bladder as well, using it as instruments. Now that is olden days. Now these days we have very particular instruments for the basti. Similarly, in Nasya, he says any medicine taken through the nasal route is only going to work as a decongestant and come out as through the mouth. Now, he does not agree to the fact that medicines can enter through the nasal route to the orifices of the face, the head, like the nasal sinuses, paranasal sinuses. So, there is also the opening of the cribriform plate. Ayurveda says that nasa hi shiraso dwaram, the nose is the gateway to the head or the opening to the head. Now it works. There are quite a lot of people who can vouch for how Nasya works for them. In such a way, he had not even mentioned about Virechana. Virechana is a detoxification measure which is done through the lower orifice. A person is made to go through Snehana and Shvedana, and then, as mentioned earlier, for Vamana also, and then detoxification is done through loose stools. Now it is done in very controlled manner. It's not like you go through more number of loose stools, or in case of Vamana, more number of bouts of vomiting, and then you just fall tired. No, it's not done like that. This is done very systematically, and the patient feels completely alright after the treatment also. So these were the things he had mentioned. Now the fifth one was Rakta Mokshana. This is where I'd like to say something here now. I'm very particular about keeping this video in English because I want to make sure more people watch this, more people understand why I'm talking about this. So in case of Rakta Mokshana, he particularly mentions about the Ayurvedic Vaidya being very clever and actually excessively clever, saying that okay, when a patient comes in, okay, I have found somebody who I can fool around with, and then he takes up a knife and cuts the vein. So that's not the way Rakta Mokshana is done, my dear fellow. I'm very sorry to burst your bubble. The procedure of Shalya Tantra or the surgical methodology in Ayurveda is very much evolved. How it is done is also very clear. The procedure is told in detail, how the proper way of usage of sharp objects as well as blunt objects. So those are called as the Shastras or the Yantras. So that is also all mentioned there. So it's not like some random act or procedure done by some shaman. I don't plan to degrade the word shaman also. They are also traditional practitioners in Africa. No, but in his words, it's not some random practice by a barbarian. So those are the Panchakarmas. And he also mentioned about the Leech therapy not being right, but then there are published papers of the NCBI as well as Elsevier publications where it is mentioned which kind of leech is used. So the kind of leech used here is Hirudina medicinalis. The enzymes present in its saliva, there are quite a lot of enzymes, but one of them is hirudin, which has medicinal properties, specifically anti-inflammatory properties. So in case of varicosity, where he mentioned in case of varicosity the leech is applied, leech in his words sees the area like mutton biryani and jumps on it. Now that might be the way he would jump on mutton biryani, but that's not how a leech does it. So here it is anti-inflammatory in nature in case of complications of varicosity, like varicose ulcer. The ulcer heals faster. So that was the study in the NCBI publication. You can all find it in the Google Scholar if you go search it. You can also find the Elsevier publication about the similar activity done when there is a comparative study of leech application as well as non-leech, treatment without leech application. So hirudin helps in anti-inflammatory aspect. It also is an anticoagulant. It helps in healing in general. So that has been proven. So With that, I would like to state here that it is not all allopathic doctors who are against Ayurveda like this. There are quite a few people who understands the system of Ayurveda, who understands and respects the system of Ayurveda, and I am very proud to say that I have a few friends among them. The place where I practice, we have a very successful chain of integrative practices. Now, integrative here is not that me being a student of Ayurveda then practice allopathy, not like that. I practice my pure Ayurveda, they practice the pure allopathy, but then we respect each other. So if there is a patient who needs an allopathic intervention, I refer them there. And if there is a patient who needs an Ayurvedic intervention, he refers the patient to me. I respect that. Now that is the way the world should go forward, because we have found out that any system of medicine has its own benefits as well as its own negative aspects. So making sure that one knows that and does it is right. Now I have heard some people say that a good doctor is one who knows when to refer. It's not like, okay, this is my patient, I should not refer to anybody, I will only do this and then do something wrong to the patient. It is also heard that some people have also mentioned that a good doctor is one who stops medication. So I don't say those who need regular medication for a long period of time, they should be given. I'm not against it. I'm not, in these people's words, I'm not one person who does some magic and tries to stop a diabetic medication of a patient or something like that and make the patient fall ill again. No, what I believe is scientific study of the situation, then try to remove unnecessary medication out of the system. So that is where I think any practitioner of any science should be doing it, because we all take an oath to take the wellness of the patient as the first priority. That should have been there, but these days it is not seen much. I think we should go back to it. I think we should first prioritize the wellness of our patients, and that is the way forward. So with that message, I would like to stop the video here. Thank you so much for hearing me through. Stay tuned for a few more videos on what I feel I should be sharing about Ayurveda. Thank you.